In this video, I will talk about intrauterine insemination, or IUI. We work as a team in Queen Mary Hospital and in Kwangwa Hospital. In our centers, ultrasound examination and intrauterine insemination are supervised or performed by subspecialists in reproductive medicine on duty roster. These are the contents about IUI that I'm going to go through in this video. First of all, indications. Intrauterine insemination, or IUI, can be done in natural cycles, mainly for couples with coital problem, that is, problem with sexual intercourse, or those who are undergoing donor insemination, that means IUI with donor sperms. The use of ovarian stimulation drugs will not improve the success in these couples, but will increase the chance of multiple pregnancy, which carries extra risk. Therefore, ovarian stimulation is not used. A maximum of 6 cycles will be offered for these couples. IUI is done in stimulated cycles for patients with endometriosis, mild male factors, or unexplained infertility. The woman should have at least one fallopian tube that is patent on hysterosalpingogram, which is the tubal patency test. The other tube can be blocked at the proximal end. The husband should have semen samples that contain more than 10 million progressively motile sperms. Stimulated cycle means ovarian stimulation will be performed by oral drugs, that is clomiphene or letrozole, or rarely gonadotropin injection. This would improve the success rate compared to natural cycle IUI for these couples. A maximum of 3 cycles of stimulated IUI will be offered to these couples. Now, I will talk about the selection criteria for public funded service in the hospital authority and also the age limit of our private patients. For public patients, the hospital authority requires that the woman must be less than 40 years old at the time when IUI is initiated. The couple must be legally married with no living child for the current marriage. And there should not be any contraindications for pregnancy in terms of medical, physical, or mental conditions. As for private patients in our private clinic run by the Hong Kong U, the age limit is less than 43 at the time when IUI is initiated. There are some screening tests that we will arrange for you before IUI is being done. For the wife, we would perform cervical smear if you are due for that, and a swab will be taken from the cervix, that is the neck of the womb, for checking chlamydia infection. Blood tests would also be arranged, and that include a complete blood picture to screen for thalassemia, rubella antibody, and VDRL, which is a test for syphilis. In addition, we'll also check hepatitis B antigen and hepatitis C and HIV antibodies. As for the husband, a semen analysis will be required to make sure that IUI is a suitable option. Blood tests will be arranged again for screening of thalassemia, hepatitis B antigen, hepatitis C, and also HIV antibodies. Now I will talk about the IUI procedure. If you are undergoing natural cycle IUI, the wife would come to our clinic on around day 10 to day 12 of your period for an ultrasound to measure the size of the leading follicle in the ovary. When the leading follicle is more than 14 millimeters in diameter, we will start to check your urine every day for an Alex search. Once the Alex search is detected, which predicts ovulation, IUI will be performed on the next day. Alternatively, if the leading follicle is already 17 millimeters or more, then we will give you an HCG injection in the evening to trigger an ovulation. An IUI will be performed 36 hours later, which will be in the morning. If you are undergoing stimulated IUI, you will be instructed to take either clomiphene or letrozole, which are oral drugs, on day 10 to day 6 of your period. On around day 10, you would attend our clinic for an ultrasound to measure the size of the leading follicle. Similarly, when the leading follicle is more than 14 millimeters in diameter, we will check your urine for an Alex search every day. When we detect an Alex search, IUI will be performed on the next day. Alternatively, an HCG injection will be given in the evening to trigger ovulation when the leading follicle is already larger than 17 millimeters. An IUI will be performed 36 hours later, which will be in the morning. Note that the cycle may be cancelled if there are too many growing follicles, which make you having a high risk of multiple pregnancy. In this situation, we will cancel the cycle and we will advise you to have contraception with condoms in that cycle to prevent pregnancy. In the morning of the scheduled IUI day, husband needs to submit the semen sample to us by masturbation. And in the laboratory, our colleagues would perform sperm washing. Basically, is to wash away the immotile sperms, to leave behind the motile sperms, so that the concentration of the motile sperms will be much increased. In the video on the left-hand side, you can see a semen sample before sperm washing. You can see some sperms moving in the video. In the video on the right-hand side is the same semen sample after sperm washing. You can see that the concentration of the sperms that are moving is much increased. And we would use this washed semen sample to do IUI. In the same morning, after sperm washing, IUI will be done in our clinic. Basically, it's like a gynecological internal examination. We will pass a small catheter into the womb through the cervix. Then the washed semen will be injected into your womb. The procedure only takes a few minutes, and you can leave immediately afterwards. How about success rate? In general, the success rate of IUI is around 10% per cycle and around 25 per 30% in 3 cycles. You will be asked to do a pregnancy test around 2 weeks after IUI, and if you are pregnant, we will arrange an ultrasound to be performed around 6 weeks and 8 weeks of gestation to confirm the pregnancy is growing normally before you will be referred for antenatal care in either the public or private sector. There are some possible complications with the IUI treatment, and that include multiple pregnancy in simulated cycles, pelvic infection after the insemination procedure because we are passing the catheter and injecting the semen sample into your uterus, but this is pretty rare. There is some concern that the fertility drugs may slightly increase the risk of ovarian cancer, but so far the evidence is still not conclusive. The chance of multiple pregnancy is around 10% in stimulated IUI cycles because drugs are used to stimulate more follicles to grow. Fortunately, most of these are twins, but occasionally we do see higher order multiple pregnancies. Multiple pregnancies carry extra risks during the pregnancy, especially increase in preterm delivery and also in many other obstetric complications. Therefore, as I mentioned before, if there are really too many growing follicles on ultrasound, then we would advise you to cancel the cycle and practice contraception in that particular cycle. You may wish to visit our website for more information on fertility treatment. We are also on social media. Please follow us. If you have any questions during treatment, you can contact us by these means. Thank you for your attention and good luck with your treatment.